Good morning, and thank you for joining us for our weekly COVID-19 pandemic update. My name is Don Walker. I'm Communications Director for Brevard County Government, and we have a panel today that includes Maria Stahl, who is the Administrator for DOH Brevard. We also have Helen Medlin, who is the Epidemiology Program Manager for DOH Brevard. We also have John Scott, our Emergency Management Director, Matt Wallace, Public Safety Director, Catherine Allen, who is here for Brevard Public Schools, and we also have as a special guest today, Dr. Eric Deppert, who is with the who's the Chief Medical Officer for the Florida Market for Steward Hospitals. And we also have Jesse Ray, our social media specialist, who will be monitoring our Facebook Live event for today for any questions that you may pose to us during our updates. So as we normally do, we will start with FDOH for an update, and I'll turn it over to Helen.
Thank you. So just going to last week's report that came out on our numbers. Our case per 100,000 last week was 351, and we have seen a decline in that rate this week. So we are improving overall, but still remain in high transmission rates. Our positivity rates of our testing is dropping. Last week we were at 12%, and I expect that we will see that decreased this week. Our cases last week, we had 2,146 reported. Again, this week's numbers will show a decrease in that. Unfortunately, our vaccination rates, we are not seeing too much of a movement on that. Again, we certainly encourage people to vaccinate against COVID, and we have seen some recommendations coming out from the CDC regarding the booster dose vaccine for the Pfizer for those 6 months after their second dose. And they're looking at those who are immunocompromised, those over 65, and then also the caveat of those on the frontline healthcare workers. At this point in time, at the Department of Health, we haven't had any direction as to when we will start vaccinating those other groups, but when we do have that information, we will certainly get it out there. Thank you.
All right, thank you, Helen. Our emergency management department has been working closely with DOH and also the state, and John Scott is here to give an update on the monoclonal antibody treatment facility and other subject matter related. John?
Thanks, Don, and good morning again. My name is John Scott. I'm the Emergency Management Director for Brevard County. I'll touch on a couple of quick items this morning. One, as Don said, we continue to offer the monoclonal antibody treatment at the Kiwanis Island Park in Merritt Island. That's 7 days a week, 9 to 5. Again, you don't need a referral or a doctor's prescription for that. That is just if you're COVID positive, if you're COVID symptomatic, or you believe you've had a close exposure. I'll talk a little bit about testing. As you know, in addition to pharmacies and Publix, those kinds of grocery stores who have been doing testing, they continue to offer it. But we've also partnered with the Department of Health, with Parish Hospital, and with several private sector vendors to offer 4 additional testing sites. I'll just go over those again. It's Parish Medical Center in Titusville. That is 7 days a week, 8 to 6. That's a drive-through location. It's the Health Department in Viera. That's Monday through Friday, 8 to 6. Both of those are appointments required. Kiwanis Island and Merritt Island is also a testing location. That's a drive-through location. That's 7 days a week, 9 to 5. No appointment necessary, but we do encourage them. And West Melbourne Community Park, which is right next to the Field of Dreams Park, also 9 to 5. That is a walk-up location. So we continue to have testing widely available. We're not seeing a large demand for it at this time. I also know that pharmacies are having now sort of where we were a couple of months ago, where they're having appointments either same day or the next day. So we're getting a whole lot better when it comes to testing availability and seeing a significant decrease in testing demand. So, Don?
All right, thank you, John. Catherine Allen with Brevard Public Schools. Any update from BPS?
Thanks, Don. My name is Catherine Allen, Senior Coordinator for Brevard Public Schools. We do have some updates for you. Obviously, we've been following the protocol set forth in quarantining and how to deal with reported exposures to COVID-19 from the Florida Department of Health. And the new Surgeon General did release information earlier this week that said that we were going to change how we were doing that. And so what that means is that our parents are now allowed to decide, once they've been notified that their child has been exposed to a COVID positive case in their school, if they will be continuing to attend, provided that their child stays asymptomatic, or they can also choose to keep their child home for 7 days to quarantine and watch them to see if symptoms are going to develop. We would like to caution our parents that while parents certainly have that choice, please be mindful that there have been several instances in our schools of children being asymptomatic. So just make sure that we keep that out there. We've received a lot of inquiries as well about the mask policy. That same update also included information about parental opt-out. We want to make sure that we address that. The school board of Brevard County just went ahead and extended our mask policy, and that happened through the end of October. The only difference now being that students and staff, while they're indoors, if they are socially distanced at 6 feet and at the approval of the instructor or staff on site, that they may remove their masks indoors. However, there is no parental opt-out that is not a medical opt-out at this time. So we are asking our families who attend our schools to please comply with the policy that is set forth by the School Board of Brevard County. They are a governing body, and that is what the district will follow. We do want to tell you that we just released our dashboard information, and again, following the trend in the community, it is trending down. We're super pleased by that. I think 67 positive cases in our schools in the last 3 days, and quite a few less quarantines in the 100 range versus 4,000. So that's all promising. However, it's definitely not time to let up on some of the things that we can do. Good hand hygiene, mask wearing, and if you're able to get vaccinated, please do so. That's all, Dawn.
All right, thank you. We've been holding these weekly updates for several months now, just as a way to keep our community informed about how this pandemic is impacting our community. We've talked a lot about our emergency responders being on the front lines, the situations they encounter with the number of daily transports that are COVID-related, and crowded emergency rooms and wait times. I reached out this past week to Stewart Hospitals and invited Dr. Eric Deppert to talk with us today to kind of give us a frontline hospitals viewpoint about what they're seeing at our major hospital systems here in Brevard County. So I will turn the floor over now to Dr. Deppert. Thank you for being here.
Thank you, Don, and thank you to the entire team. These are unprecedented times that we're going through. We haven't seen this before. I'd be remiss if I didn't give a huge hug and a shout out to my EMS colleagues. The front line is obviously the most important thing we have. We can't operate, we can't fix, we can't heal, we can't take care of patients if you don't bring them into us. And not only the COVID-19 patients, but let's not forget that there were a number of other patients out there with strokes and heart attacks, emphysema exacerbations, pneumonias, and other conditions. So kudos to your team. I can't thank you enough. On behalf of the entire medical staff and our family at Stewart Hospitals, thank you. Thank you. It's been tough. I oftentimes say, Don, that some men and some women are called to be priests, sheikhs, mullahs, and rabbis. And others of us are called to be ministers to the sick. It's what we do. It's what all of us around this table do. It takes a village, and it has not been easy. So again, thank you to all the members here today. You can see on the first slide, all Brevard County hospitals were functioning at or above maximum capacity. We had patients in the ICU. ICU was full. We made another ICU. That one got full. We made another one. We continue to take care of our patients. That's what we do. So kudos to our nurses and also all of our staff for not only Stewart, but for all of our Florida hospitals. Every hospital in Brevard County, again, opened up additional capacity to deal with the recent surge, and I'll show you that in a couple minutes. We all had to procure additional ventilators and other oxygen assist devices. Oxygen itself was a problem. As you can recall, there was a water ban in Orlando because of the supply of oxygen. So thank you to emergency management for allowing us to have that precious resource. Every hospital had to defer or delay non-urgent procedures in order to ensure that enough beds were there for our COVID patients and resources. So every day I had to look at the operating room schedules for all three of our hospitals, as did all of the hospitals in our county and state, and look for cases that could wait. Not an easy decision. Not an easy decision. The worst part about this all is this third phase has been brutal, not just in numbers, but the aggressiveness in particular to younger patients. We've seen a huge number of younger patients, 20s and 30s on ventilators, and dying. No death is acceptable, don't get me wrong. But the first phase, we had a lot of people that were very sick with other medical problems, heart failure, COPD, cancers, and they were older. Not that it's easier to accept, but it wasn't nearly as shocking, potentially, right? We're seeing young people, everyday occurrence. So it's been tough. I'll share with you some Florida numbers that I think are very helpful and illustrative of what we are dealing with today. You can see on the left the summer of 2020 and the peak, the winter of 2021, the peak, and the absolute devastation this summer. Bad news, devastation, 17,000 patients at the peak. Down today to in the 10,000 range, maybe a little lower. I haven't had the numbers for this week. As of last week, it was about 10,000 hospitalizations. Call your attention to the ICU bed availability. The first peak, we were down to 15% of our beds were available, meaning that we were stressed, right? Same thing basically in the mid-peak, and again now, 4.7% of traditional ICU beds were available to take care of our community for heart attacks, strokes, surgeries, things of that nature. It was an absolutely devastating occurrence. Widening the lens, you can see here, this third peak, 17,000 was the peak, right? Down to about 10,000 last week. And again, I already shared with you the ICU beds. This is a very powerful slide I want to share with the community and the members. If you look at the three peaks, this is focusing just solely on Rockledge Regional Medical Center. And I focused here on Rockledge Regional because it tells the story of Stewart here and for all of our partner hospitals, but particularly Stewart. We made a choice during the first peak to cohort our COVID patients at Rockledge so that we could have the expertise there, Don, to take care of the patients and offer them the best chance of survival. So peak one, you see the Rockledge census, and that included every patient who presented to Melbourne or Sebastian that was EMS transported. Again, thank you again to EMS, transported up to Rockledge. The second peak was the same. The third peak, different story. Third peak, we were unable to, due to the sheer volume, to send people to Rockledge. So Melbourne was at capacity with COVID patients. Sebastian, at capacity with COVID patients. And that peak right there, that's just Rockledge. So I think it tells you a story of where we were. And thank God it's getting better. So regarding vaccines, I mean, from my perspective, the key to your success, Don, is hand washing, right? Social distancing, wearing a mask, and vaccination. Are there risks and side effects of the vaccine? Sure. Small. There are some. Is it 100% effective? No, no vaccine is. I liken it, Don, to getting into your car and driving down the street. Are seatbelts 100% effective for my EMS colleagues? No. No. But do we wear them? And do they mitigate against death and injury? Absolutely we do. The COVID vaccine, Don, is likely the safest vaccine humanity has ever produced and has documented protection. Local, objective, factual data, it's there. I mean, people can go on the web and they can find all sorts of stuff on Google, et cetera, or Wikipedia. It's not peer-reviewed literature. The things that you're hearing on the web, from my perspective, contrary and misleading and likely false. Don, I lead you to, I'm going to go back to a quote from JFK. Remember John Fitzgerald Kennedy, President of the United States? God rest his soul. He said in 1963 at the Yale commencement address to the graduating students, he said, "The greatest enemy of truth is very often not the lie. Deliberate, dishonest, and deceitful, but the myth, persistent, persuasive, and unrealistic." And he begged those students to not hold true the myths of their forebears. I am begging you, I'm begging the community to follow evidence-based medicine. Wash your hands, wear a mask, socially distance, and vaccinate. Proud to announce that Rockledge Regional Medical Center and Stewart have had a vaccine clinic, Don. Close to 7,000 doses that have been given. That include our employees, communities, members, and business groups. About 3,400 patients have been totally vaccinated with both shots. We still have some more that we're doing to follow up on that second dose, and likely now the third dose, right, as we heard last night from the CDC. And we probably have about 3,400 fully vaccinated patients through our clinic at Rockledge.
Can you go back 2 slides?
Sure.
And maybe you touched on this, but when you look at the top of that slide and you're talking about, the fully vaccinated, number of admissions, we get we're doing a weekly update where we show in our 3 major hospital systems the numbers of fully vaccinated versus not fully vaccinated that are hospitalized.
Correct.
Obviously, there's an overwhelming number of those numbers that are in the hospitals that are not fully vaccinated. What can you tell people about that?
So I can tell you that at the peak, or as we were rapidly ascending to the peak, we had 95 to 99% of our patients that were hospitalized were unvaccinated. I'll say it again. 95 to 99% of our patients that were hospitalized were unvaccinated. In addition, greater than 95% in that same range of our patients who unfortunately died in the hospital were unvaccinated.
And you mentioned, we've heard stories about people that have been in ICU who have, at that point, second guessed their decision not to get vaccinated. You've had people tell you that they've had regrets.
It's been tough, Don. Yeah. Yeah, we've had a number of patients that want to be vaccinated once hospitalized or regretted the decision. There's no doubt.
All right. Thank you very much, Dr. Deppert. We appreciate it. I will turn it over to Jesse Ray, our social media specialist, who's been monitoring for questions, and we'll pose those to our panelists. Jesse?
Awesome. Thanks, Don. Okay, so how many COVID-19 related patient deaths has Stewart Medical Centers in Melbourne and Rockledge had since June of 2021?
I'm not going to comment on the total number of deaths. What I will say is that 1 death is unacceptable. All of the Brevard County hospitals have had patients die from COVID-19. So whether, we had 1 or someone had 2 or they have 4 and we had 3, doesn't make a difference. People have died in the hospital from COVID-19, as I said, and the majority of them were unvaccinated.
Okay. So Florida's new Surgeon General, who also heads the Florida Department of Health, has in the past raised questions about the safety of COVID-19 vaccines and the effectiveness of face coverings. How would you respond to that in light of the message that we're all trying to convey about the importance of vaccinations and face coverings?
So I'll take the opportunity here to answer the question, and I'll defer to the rest of the panel. But From my perspective, on the front lines, and perhaps my EMS colleague can also weigh in, the frontline workers are the highest risk exposure to have occupational acquisition of this disease. And so what do we do on the front lines? Well, we wash our hands, we wear masks, right? We socially distance. Fortunately, you know, the OSHA guidelines that we've implemented, which are the same as what we're saying here, to wash your hands, socially distance, wear a mask. We have had some of our employees sick. Yeah, it's happened. Not sure if any of them actually were traced from an epidemiologic perspective back to the hospital. They were more likely community acquired. But the number of positivity employees that were positive from COVID-19 exposure in the hospital, again, I don't know of any or very few, which would mean that what we're doing works, right? I mean, so washing hands, socially distancing, wearing a mask, it works. It works when people are coughing in your face and you're the highest risk. It should work in the community.
Okay. What specific metrics would we be looking for in case rates and vaccination percentages that would make us more optimistic about improvements in the pandemic status locally?
Maria, you can take that?
Yeah, I can go ahead and mention that. And as we've all said, through the last several weeks, we did have our peak, and we have seen cases and positivity rates decrease every week, which is wonderful. I believe, and I'll let Dr. Deppert add to what I'm saying, but I think what we need to see is a sustained positivity rate of less than 5%, and not just a one-time sustained. I also think that we need to see a sustained case per 100,000 less than 100. So both of those things I think we need to see sustained for a while. Dr. Deppert, I don't know if you have anything to add.
I agree. I think your epidemiologic models. Your epidemiologic modeling that you're doing, looking at community transmission, positivity rates, things of that nature is spot on. And we have the ability also to look at other markets across the country and internationally, right? So we have experience in Israel and the United Kingdom and showing, some good evidence there to support what you're saying. So I concur.
Okay. Mr. Scott, can you still walk into the monoclonal antibody site? Is that still possible?
Absolutely.
Yeah, awesome. And I'm not sure who to direct this at, but we got a question about what threshold cycle are the labs using when PCR testing for COVID? I don't know. John? I don't know.
Not sure I can answer that question. We can get back to you, but I'm not sure I can answer that question.
I can tell you it does vary between each lab, but I'm not sure of this specific for each one of them.
Okay. Do we know what percentage of Brevardians are vaccinated at this point?
I can take that one. Currently, we have 67% of the 12-plus population that has received at least one dose. We have 59% that are complete. And then again, I will go ahead and add the 12 to 19. As I have the last couple weeks, we have 47% vaccinated with 40% complete. I do not have the number for the total population, zero and up.
Okay.
Actually, I do have that number. So I looked at that today. So total population, we have 52% who have completed vaccination, and we have 59% who have had a vaccine dose.
All right, and Maria and Helen, just to clarify also, I mean, we hear a lot on the news on any given day about herd immunity. Is there a magic number that we're looking for in Brevard County that's going to put everybody at ease?
Herd immunity is really difficult to define. Obviously, if you're just looking at vaccinations, you would look at over 90% vaccination rate. What we really want to see when you're looking at herd immunity is that you're only actually getting 1 or 2 cases of the disease in your community. And that would be a successful herd community. Herd immunity. So difficult to actually look at where we're at the moment. Certainly we're nowhere near it when we have the transmission rates that we're having at this point in time. You cannot look at our numbers of vaccinated and add our numbers of positive cases, because we don't know from those positive cases who of those have been vaccinated, so the numbers skew. Nor do we know in the long term how long the natural immunity one gets from the disease. Typically from other coronaviruses, we saw anything from 6 months to 2 years. Do we see that from this one? They're still looking at that data. And then at this point in time, again, we're looking at how long will the immunity last for the vaccines as well. So herd immunity is a long way away at this point in time.
So Don, I'd like to just add on to that, though, that, from a herd immunity perspective, there's only really 2 ways to get the herd immune, right? One is you vaccinate people, and 2 is you let the disease just continue to devastate your community, causing morbidity and mortality. So let people get it, let them keep coming to the hospital, and let people get sick, God forbid, and they die, and maybe we'll get the herd immunity. Or vaccinate. That's the stark reality.
Thank you, Doctor.
So, Doctor, while we were looking at the graphics that you had that kind of showed our cases last year versus the cases this year, but we're also saying that, last year we didn't have a vaccine, and this year we do. Not only do we have it, but, at least half of us or so are vaccinated. So would it be safe to say that that chart looks the way it does because last year we had lots of quarantines in place and mask mandates in place and stay home orders in place, when this year we don't have that? Would it be safe to say that that's why we're seeing such a difference, even though we have the vaccine when we didn't last year?
I'm not sure you can make that jump from an epidemiologic perspective, and I'm going to defer to my colleague who's much more erudite in epidemiology than I am. But I go back to, again, looking at the patients who are hospitalized. The stark reality is that the majority of them, overwhelming 95, 99%, depending on where in that peak you talk about, 87% probably today, are unvaccinated. Unvaccinated hospitalized and unvaccinated dying. That's all I can really comment on, but I'll defer to my colleague.
It is hard to come to that conclusion. Certainly, I think very early on when we had mitigation in place, it slowed down the progress. But we had 2 different viruses, really. We have the Delta virus at this point in time, which is much more transmissible. It replicates much faster. So when you actually are exposed, it typically probably requires a less exposure for it to replicate and then for you to become ill, as compared to the initial coronavirus that we experienced. So we're really looking at 2 different scenarios and stories, and I don't think that one can be compared to the other.
Okay. Are we seeing, do we know much about any long-term side effects from the vaccine?
So I can address that. This is one vaccine that I don't know that we have seen any other vaccine given to populations to this quantity. Even vaccines that have been around for a long time, if you added them up, I don't know that you would see that there's any vaccine out there that's been given in this quantity. And when you look at the quantity of vaccine that's been given, at this point in time, we are not seeing any data or any evidence of long-term effects from the vaccine. Certainly, there are some immediate side effects that people experience, and there's certainly data out there. The one thing that I'd like to say about a vaccine is there is no medication, no treatment on the market that is so closely monitored as vaccines here in the United States. And the United States has a very good track record on monitoring vaccines. It has had a system in place for a long time, and I'm sorry, I don't know exact years, but the vaccine, the VAERS reporting system, does not exist for any other medication or treatment out there, and everything that is reported by whether it be the individual themselves who has the right to report, or a doctor, a hospital, anyone, every one of those is taken seriously and it is looked at very, very closely. There is no other medication. There's certainly no herbal treatments out there. There is nothing out there that is so closely monitored as a vaccine.
Okay, thank you. And are we seeing non-COVID related deaths in the hospital because our hospitals are inundated with COVID related patients, and so the other patients are having a hard time being seen?
So I could answer that question.
Okay.
My answer to you would be no. We've been open the whole time.
Mm-hmm.
We have flexed our staff. We've had our nurses, God bless our nurses, working double and triple shifts. We've brought people in. We've been open for business the whole time. Our emergency management teams are doing the same. Is there potentially a case where there may have been a delay, I don't know, from an EMS perspective, because you're out there taking care of COVID patients and running them in, and maybe there's an MI somewhere? I guess maybe that could have happened. But I'm not familiar with any metrics that I know of from us or any of our Brevard County hospitals that would say that we had patients die in the hospital because of a COVID distraction. We've been open for business. We will continue to be open for business. And we'll do what we need to do to be prepared.
Excellent.
We've had
Thanks.
actually, our incident command center has been open now for about 3 months. We meet daily to make sure that we have the tools and resources to be proactive and take care of our patients.
Gotcha. Don, I think that's all of the legitimate questions we have for today.
All right, very good. Again, my thanks to Dr. Deppert for being here today. Some very eye-opening and insightful information. We appreciate it. And we will be back next Friday for another update at 11:30 a.m. So please join us then. Thank you very much.